When you do a chin augmentation, this is a really important part of the procedure that can be missed. This tissue right here is fibrous and it's an anterior mandibular ligament. If you don't cut this and you start elevating the tissue for your chin implant, you might hit the nerve. So this is the most important part of the surgery, is just go ahead and transect it and stay in this vector here and you'll be safe, rather than going up. This is the true vector for a chin implant. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results. Nanja, welcome back. How are you?
Hi,
It's been a while.
How are you doing, right?
Thanks for coming back. How have you been?
Doing great.
How's Bakersfield?
My name is Nanja. I live in Bakersfield, California, beautiful Bakersfield, California. I'm just a really outgoing lady and love having fun and love looking good and want to keep that wagon going. I've been wanting a chin implant since my early teens. I think that this is a really good step towards confidence and being able to present yourself. This is a choice that I decided to make a long time ago, and it took me a very long time to pick the right doctor. Dr. Dhir is a pioneer in another procedure called a mandibular implant. So as I was doing the research, that's what I was originally going for. However, during the initial consultation, him being very conservative and taking into consideration my look and aesthetics of my face, we decided to go with the smaller chin implant.
We talked about the custom and the prefabricated,
We
but you want to
did.
stick more with the chin.
Yeah,
I think that's a
yeah.
great thing to think about. I think that'll give you a lot of facial harmony. We talked about this the first time we met, is that, you know, the large eyes, the cheekbones are beautiful, the lips are full, the jaw has been weak for you, and you've felt that for a really long time.
Very much
right?
so,
And
yes.
so by adding a little bit of kind of more projection or fullness to the chin area, it'll make people look at your eyes. And it'll kind of harmonize the face, and that will be really good for you. And at the same time, we talked about also that I want to do a little liposuction and contouring of the jawline. And that's not because you have any fat there per se. It's to take out any fat that's there, and also just to give the skin a little chance to tighten. So on the side profile, the chin for a female should come up to that line. It can go up to the line or a little bit away from it, because if you go too far, it does strengthen a little bit too far, and then now when you were top heavy, now you're bottom heavy. And we want people to look at only your eyes and everything be proportional.
He taught me to want what I needed as opposed to just want what I wanted. That difference and that change showed me a lot of his integrity and ethics.
During surgery, I have sizers.
Okay.
So I'll have small, medium, large, extra large. I'm gonna put them all in.
Okay.
One by one and see the one I like.
Right.
It might be medium, it might be large minus where I take away, or it might be large. It depends on what I want. So once I put it in, it's gonna set up exactly the distance I want forward.
Okay.
And then what I do is that I also want to customize it where it looks like the goal that, or at least closer to the goal that we want. And that's why you're gonna send me the pictures of people you think you look like, or maybe even celebrity shapes that you kind of like.
Okay.
I can't do everything exactly, but it gives me a sense of how you like it to be. I'll see you in about a month for surgery.
You will.
All right, so it's our surgical day. It's about 7 a.m. I know it's a little early, but the patient hasn't eaten all night, which is safe for anesthesia, and it's a good time to get started and there's no distractions. I always meet with my patients in the morning to make sure that they know that we're still on the same plan. Today we're gonna do a chin augmentation. Just putting a little bit of volume and projection in the small area of the chin can actually harmonize the entire face, so it's a pretty powerful procedure.
I am absolutely ready. Let's get this thing going.
What I'm marking here is just general landmarks for me. I circle a little bit here. She has not much fat here at all, actually. I want the middle to be obviously multiple landmarks. My incision will be under the chin on a crease, so it hides very well. There's two nerves that give us sensation here, which is very important just to make sure we maintain those. And then a general idea of where I've kind of planned to put my chin implant, and that's it. So one of the most important parts of surgery is always having the least amount of blood possible. So we've completed an incision under the neck, which is very small. We dissected down to bone. As you can see, there's a bloodless field, so there's no blood. That helps with swelling and also bruising, and also gets us a better result during surgery because we can actually see what we're trying to project and augment. Once we get down to bone,
We dissect a pocket clearly on bone on both sides. We make a nice little pocket here and here. There's a nerve on both sides here that we protect. That gives a sensation of the chin. And now we can start to size different implants to find the right size for her. And as you can see, it goes right about to the line, and we talk to her about it that we're gonna stay behind it. So I think we're good. So here's our sterilized chin implant. It's a large. I marked areas that I want to contour. So I want to take the top layer off so it's not so high up the chin. And also on the sides, I want to contour a little bit more like she discussed in the pictures that she desired for her desired look. So what we're going to do now is that I'm going to use a knife and I'm going to contour for a little more customization of her implant. I'm very pleased with the size that we've chosen. We contoured it. We're getting ready now for the placement of the implant in a more permanent position. So what I'm going to do now is I'm irrigating the pocket with antibiotic solution. Okay, so now we're going to secure the implant to the bottom of the jaw so that it stays in place while it heals. These are not permanent stitches. I don't like to use those around the implant. So we're gonna do that right now. We're gonna do the liposuction and then we'll close the skin and we'll be done. We're finally done. Here's the incision closed. You can see that's gonna heal very, very well. And we have our chin projected. It's contoured where she wanted based on her picture to square it out a little bit. She's got a nice neckline now. That skin looseness that she's talking about is going to tighten over the next coming weeks, and we're done.
I feel great. It feels absolutely wonderful. Feels like me. I like me, but I really like this new me. I can't stop looking at this new me. When he did the liposuction on the chin, I did have a bit of a double chin there. And it wasn't because I was overweight, it was just because I didn't have anything filling up that space. After he put that large implant in, that all was filled up and I didn't have any sagging skin there. And he gave me this wonderful streamlined neck, this long, beautiful neck. And so yeah, I feel a lot younger, a lot prettier, a lot more confident. I had spent years in front of the mirror trying to cover up the chin. So it's been nice to spend all this new time, you know, kind of not having to cover that up, not having to stick that jaw down and forward, not having to, you know, we all hold ourselves and try to present ourselves in the best possible light. So it's nice that I can just kind of be slack-jawed and just, you know, be at rest, and still have a beautiful profile without having to stick that chin out in such an uncomfortable position.
It looks really nice. We picked a really nice size. What I feel is that by doing this, it harmonized the rest of your face. We talked about this when we first met, that weakness of a chin can make other things out of sorts, and you start pointing at different things or why you do this. But by doing this, your nose came in line, like you said, the first time we saw you after surgery, you felt like your nose
got smaller.
Harmonized. Yep. And you thanked your dad finally for this nose, you said, right?
Really?
I remember, yeah.
Thanks, Dad.
You said, thanks, Dad, for this, because now I actually like it. So it harmonizes with your cheekbones and your eyes. And now when I look at you, I'm actually just drawn to your eyes.
Okay.
And that means the face is harmonized. And I'm glad that you said there's an inner peace. That's the most important part that we talked about, was I want you to feel just good inside. And then you'll be able to portray beauty on the outside. So I'm happy we could get that for you.
Yeah. I'm getting a lot more looks. That's true. I mean, I got some looks before, but I didn't know I was really cracking some necks there. I mean, really, they really are looking. I'm like, wow, I didn't know that. I mean, I've been looked at before, but damn, I didn't know I was gonna get all that. You know? And I am. And I'll take all of that at 46. Ooh, I'll take it. I'll put that in the bank.
So that was Nanja at her 1-month follow-up. Surgically, she's completely healed. Her incision was very small under the chin, and that'll be fading away even more than it already has up to 1 year, and it looks great. So surgically, I'm very proud. She's healthy and she's safe. Personally, it was great for you guys to all see what facial harmony can do for a patient. She said that she was missing a part of her face. What that means to me is that she doesn't feel balanced. And by adding a simple chin implant, you can see how the face got balanced. And in her own words, again, she said she had an inner peace. Truly for me, that's why I do this. It was the best compliment for me for today, and I'm glad you guys got to watch it. That's why I do what I do, and I hope that I can bring inner peace and confidence to all of my patients, one patient at a time. Thanks for watching, everyone. You can follow me on Twitter at Dr. Dhir MD, on Instagram at Dhir Plastic Surgery, at my website at drdhir.com, and see you at the next episode of Plastic.